this is Brandy Landry. Today we're going to be assessing the abdomen. Hi, Miss Landry. My name is Brandy. I'm going to be your nurse today, okay? We're going to go ahead and take a look at your abdomen. First thing we'll do is we'll take down the covers. Let's see. We'll make sure that our patient has on a gown and that I'm on the right side of the patient. Make sure the patient has emptied their bladder as well before we begin. First thing I'll do is be inspecting the abdomen to see the color, see if there's any jaundice, paleness, petechiae, rashes, scars, or any stretch marks. We want to be making sure that there isn't any presence of bruising or any scars that are not healing well. I will also be inspecting the umbilicus here, checking to see if there's any distension or any presence of hernias or any bruising around the umbilicus as well. I will be down on the level of the patient so that I can inspect the abdomen well. I will be also looking at the patient's aorta here to see if there's any pulsations here, which will be right here in this epigastric area. Be watching, and looking. You can kind of see here the pulsations of the abdomen, of the aorta. You want to make sure that it's not anything that's like vigorous pulsations or anything. That would be alarming. I will also be assessing the abdomen for symmetry, and I'll also be looking for peristalsis, which peristalsis is not a normal finding that you'd find when you're just inspecting the abdomen, unless the patient is extremely thin or possibly even malnourished. The next thing that I'll do is assess the abdomen. Go ahead and auscultate with the diaphragm of the stethoscope. I will start in the right lower quadrant, and I'll listen for 5 to 15 seconds in each quadrant. And noting if the patient has hyperactive bowel sounds, hypoactive bowel sounds, normal bowel sounds, or even after 5 minutes, if I don't hear any bowel sounds, then it'll be classified as absent bowel sounds. And the next thing that I'll do is be auscultating for vascular sounds such as bruits. I'll go ahead first using the bell of my stethoscope, and I'll assess here at the aorta. And you generally will not hear bruits unless there's an abnormality. Then I'll also be checking the renal arteries here for any sound like bruits. And then also again here, the iliac arteries. And then lastly with the femoral arteries. Let's see. And the next thing I'll do is using the bell of the stethoscope, I'm going to be going to the epigastric area again where the aorta is. And I will be listening for venous hum. Venous hum is not generally heard in a normal assessment. I'll also go to the base of the ribs at the lower part of the rib cage using my diaphragm, and we'll be assessing the liver for any friction rub. And then again on this left side is the spleen, and listening and auscultating for friction rub as well. And the next thing I'll do after that is going to be percussing. Percussion is going to begin in the right upper quadrant, and I'll be listening for any tympany. What we'll do, we'll start here, right upper quadrant, and any dullness could be an indication of an abnormality. Listening for tympany. Dullness is normal to hear under the liver and the spleen areas. Any increased tympany that you hear in a distended abdomen could indicate any type of like a gas pattern or something of that nature. The next thing I'll do is going to be to percuss. Want to find the liver so that we can measure the liver. What I'll do first is, starting in this right lower quadrant midclavicular line, I will start here, and you have increased tympany here. Whenever you get to this point here, you feel a dullness. That will mark the lower boundary of your liver. To find the upper part of the liver, we'll go ahead, we'll go here and we'll begin at the right upper part of the chest, and you can tell we're finding the top border of here, and we're going to mark our lower and higher boundaries, measuring, and it should be, the liver is generally 6 to 12 centimeters. Then we'll go ahead and we'll percuss the spleen, which is actually on this side. Sorry if my hands are cold. We will go left mid-axillary line here, and at the base of the rib cage here. The spleen is not normally palpable here, but you can also tell the difference whenever you have an increased hyperresonance. That's whenever the spleen ends. Then we will also, I'll go ahead and get Miss Landry to sit up, and we're going to be assessing the kidneys here on the left side. Use my non-dominant hand here, noting any tenderness. Any tenderness, Miss Landry?
No.
Okay, I'll get you to go lie back down. Thank you. And then after that, we're going to go ahead and we'll lightly palpate the abdomen. We're wanting to see if there's any tenderness. Any tenderness, Miss Landry? No. Okay, we're checking every quadrant for symmetry, noting any masses. Then after we do a light palpation, we'll go through and we'll do a little bit deeper, looking for any masses, abnormalities. All right. And then next thing we'll do is I'm going to use my thumb and my first finger here, and we're going to the aorta of the abdomen. And, you know, we're checking the size first off, but we're also checking the pulse here. It's slightly left of the midline, and we're checking for extreme pulsations here. We'll also go ahead and at this time and palpate the liver. I'll get you, Miss Landry, in just a second to take a big deep breath for me, okay? Let's see. We're going to go ahead and put my left under here, and my right is going to go right here at the bottom of the rib cage. I'm going to get you to go ahead and inhale. Good. All right, and you can exhale. Good job. And then whenever you're feeling the liver, it should not be hard. That it would be an abnormal finding. The next thing, we'll go ahead and palpate the spleen. I'm going to reach over this abdomen right here, again at the bottom of the rib cage here, left costal margin. And I'm going to go ahead and get you to inhale for me, okay? The spleen is not generally palpable, and I do not feel one now. All right. This concludes our assessment of your abdomen, Miss Landry. Thank you.